Chronic hand eczema is a really common problem. It affects about 10% of adults worldwide. And for a lot of our patients, it's more moderate or severe. And that means that they have hands that are unable to really work in our everyday needs. So you can imagine patients who have a hard time just doing household chores, hard time washing dishes, opening a jar. Imagine if your hands are painful and itchy and fissured. You're in a professional setting and somebody puts out their hand to shake your hand and you feel humiliated because your hands are maybe red and cracked and bleeding. So not only is it physically uncomfortable, but it's emotionally devastating for our patients because it really does impact every aspect of their lives. And it's hard to believe that it's so common, it's so devastating. Yet when we look at our treatments that are available, there was nothing that was FDA approved for the treatment of moderate to severe chronic hand eczema until we had this recent approval for Delgocitinib. We would treat these patients every day. And often our first line was topical corticosteroids. And for these patients who have more significant disease, that meant having to use more and more potent topical steroids. And I consider this to be a short term solution to a long term problem because this is a disease that can last for decades. And we know with especially potent topical steroids, they can work quickly, but we're not to use them on a long-term basis because they do have some local side effects. They can thin out the skin and it's just not a long-term solution. We've used other non-steroidal options that have some modest efficacy. And what's interesting about chronic hand eczema is it's a heterogeneous disease. There's not one particular cytokine that we know is really at the root cause of this. It can be caused by a number of different things. It can be caused by an atopic condition, by an allergic condition, by an irritant condition. So there are a lot of different reasons for having it. A lot of people have multiple different reasons. It might flare up because of the job that they do. We see it especially in people who work in a food industry or hairdressers or healthcare workers. So it's something that, we've treated. Sometimes people will even go on systemic therapies for treatment. Sometimes they use systemic steroids or the more broad spectrum immunosuppressants, but we didn't really have something that was more targeted for chronic hand eczema. The really important thing is that we get something that's effective, but also safe. So this was a study for adults who had moderate to severe chronic hand eczema, and they could have had a variety of different reasons for that. They had to have failed topical steroids in the past or other topical nonsteroidal options. And they were entered into the study where they used the medication twice a day over 16 weeks. And it was a two-arm study. So the other arm was just the vehicle itself. And these patients, again, moderate to severe disease involving their hands, and we're treating them with monotherapy. So that means they couldn't use anything else other than the Delgocitinib over the course of 16 weeks. And what the FDA asks is that we get these patients who had moderate or severe disease and get them all the way down to clear or almost clear. And by definition, that's a 2 or a 3 or even a 4 grade improvement. So that was the primary endpoint, was getting them to a clear or almost clear, or a 75% improvement in their overall disease severity was something that was also looked at, as well as the reduction of itch, a number of primary as well as secondary endpoints. And the good news is at the end of 16 weeks, we found a statistically significant difference in those patients who were on active treatment as compared to the vehicle. In fact, up to 29% of those patients using this drug as monotherapy alone got to clear, almost clear, compared with up to about 10% using the vehicle alone. I think that, this is a huge step forward in helping our patients. And I think that this is an area that continues to deserve more research and development. We might see new drugs on the horizon in the future, but I think what doctors are looking for ideally is something that's topical Ideally, we like to use something that gets right at the heart of the disease, something that doesn't have systemic complications. If we can manage this with topical therapy safely and effectively, I think that's really a win-win for our patients as well as our prescribers. So we'll see what the future holds, but this is an area that has been largely ignored, and it's wonderful to see that it's getting so much recognition and a new treatment option today.